What has been attracting attention in recent years is this: in the stomach. When you perform an ultrasound examination after filling the stomach with bottled milk tea, the ultrasound beam enters more easily, making the pancreas appear clearer. So if you want to see as much detail as possible with an ultrasound, you can drink something first, especially afternoon tea milk tea, and have the endoscopy done. I recommend visiting a hospital. Good morning. In this video, I'll discuss dangerous signs you shouldn't ignore. These are the early symptoms of pancreatic cancer. Pancreatic cancer is a very frightening cancer, and its 5-year survival rate is said to be less than 10%. Every year, pancreatic cancer ranks among the top causes of cancer-related deaths by organ in Japan. The pancreas is called the silent organ, making it difficult to notice early symptoms. And unlike stomach or colon cancer, there are no established cancer screenings for it. The legendary manager Shinichi Hoshino and Apple's Steve Jobs also lost their lives to pancreatic cancer. However, in recent years, advances in medicine have. If pancreatic cancer is less than 1 centimeter or at stage 1, the 5-year survival rate is said to be 80% or higher. Pancreatic cancer is often advanced when found, so I'll explain 5 key early symptoms to help more people detect it sooner. Early signs include changes in urine or skin color and back symptoms. Noticing these signs is important, but it's also vital to reduce your risk before the disease develops. Using data, I'll clearly explain pancreatic cancer risks and cover topics rarely discussed in other media or on YouTube. Which hospital should you visit if you're concerned, and which tests are effective? I'll explain from my experience as a doctor treating gastrointestinal diseases and pancreatic cancer in outpatient clinics. By listening to this video, you may be able to detect pancreatic cancer early or reduce your chances of developing it, so please watch until the end. So let's start with the early symptoms of pancreatic cancer. I will explain the top 5 early symptoms. Next, I will introduce 8 causes that increase the risk of pancreatic cancer. Lastly, if you're concerned about pancreatic cancer and want testing, which department should you visit and what tests should you get? I'll briefly explain these. I've summarized the important points in a clear and easy to understand way, so I'd be happy if you could take notes while listening. The first of the 5 early symptoms of pancreatic cancer that are dangerous to miss is abdominal or back pain. The reason why back pain occurs is because the pancreas is actually an organ located toward the back. To put it simply, think of the pancreas as an organ that is behind the stomach. Because it is deep inside the body, early symptoms are hard to notice, which is why it is called the silent organ. And since it is located toward the back, when there is an abnormality in the pancreas due to pancreatic cancer, many people report back pain. And it's not just back pain, it can also cause abdominal pain. If you are experiencing severe abdominal pain, there is a possibility that it could be pancreatitis caused by pancreatic cancer. The pancreas is normally, it helps with digestion when you eat. When you eat food by mouth, the food goes into your stomach and then passes through the duodenum. In this part of the duodenum, digestive enzymes called pancreatic juice are secreted from the pancreas to help digest food. However, when pancreatic cancer develops, the duct that secretes these digestive enzymes from the pancreas, called the pancreatic duct, can become blocked or obstructed. As a result, the digestive enzymes that are supposed to break down food end up breaking down the pancreas itself, which causes abdominal pain. That makes sense, doesn't it? The pain comes from the pancreas dissolving, so it's known for being extremely painful. Also, the abdominal or back pain caused by pancreatic cancer tends to get worse when you move your body. It's not a pain that comes and goes with movement, but rather a pain that persists even when you're still. By the way, pain that gets worse when you move is often related to muscles or bones. Now, let's move on to the second of the 5 early symptoms of pancreatic cancer that are dangerous if missed. It's the onset of diabetes or a worsening of diabetes. The reason for this is the pancreas not only produces digestive enzymes, but also secretes insulin, a hormone that lowers blood sugar levels. When cancer develops in the pancreas and something goes wrong, the secretion of insulin from the pancreas decreases, making it harder to lower blood sugar levels. So blood sugar rises, diabetes can worsen or even develop as a result. For example, someone might suddenly develop diabetes even though there is no family history of the disease. Even without changes in eating habits or with a healthy lifestyle, some people suddenly see their condition worsen or are diagnosed with diabetes. In these cases, pancreatic cancer could be the cause. However, it's also difficult for people who haven't been diagnosed with diabetes to notice its early symptoms. One well-known symptom of diabetes is having a dry mouth and drinking a lot of fluids. As a result, you urinate more. This is called excessive thirst and urination. If you've recently felt very thirsty and are urinating more than usual, if you feel that way, you can easily check for diabetes with a blood test or during a health checkup, so please consider getting tested. Early symptoms of pancreatic cancer that are dangerous if overlooked. Top 5. The third one is jaundice. Simply put, jaundice is when your skin turns yellow. Why does your skin turn yellow when you get pancreatic cancer? That's because pancreatic cancer often develops in what's called the head of the pancreas. This head of the pancreas is actually the area where bile secreted from the liver merges. If cancer develops here, it blocks the pathway for bile as well. Actually, bile is what gives our stool its brown color. When the bile gets blocked, it can't reach the stool and instead circulates throughout the body. This causes the skin to turn yellow. However, for people with a naturally yellowish skin tone, it can be hard to tell if it's jaundice or just their natural skin tone. In these cases, check your conjunctiva. If the whites of your eyes are turning yellow, it may indicate jaundice. In addition, eating too many mandarins can also make you turn yellow, but if the yellowing is caused by jaundice, your whole body may become yellow and you may also experience itching, which is another characteristic. When bile accumulates in the skin, itching appears. In addition, since bile circulates throughout the body and is excreted in the urine, a characteristic sign is that the color of your urine becomes darker than usual, turning brownish. Possible early symptom of pancreatic cancer. Such signs can be dangerous if ignored. The fourth point out of the 5 is weight loss. This is common to all types of cancer, but cancer absorbs nutrients and grows rapidly. So you can't absorb nutrients from the food you eat, and your weight decreases. As a guideline, if you lose more than 4.5 kilograms in 6 months, or if you lose more than 5% of your body weight in 6 months, that's considered pathological weight loss. So please consider seeing a doctor, since 4.5 kilograms in 6 months means losing about 1 kilogram per month. If you're losing weight at that pace, it's already too much, so use that as a reference. The 5th early symptom of pancreatic cancer that is dangerous if overlooked is this: fatigue. It's that feeling of sluggishness. Everyone feels fatigue when they're not feeling well, not just with pancreatic cancer. That's exactly right. What I want to say here is that the early symptoms of pancreatic cancer are hard to notice. This video was made with reference to the 2022 Pancreatic Cancer Clinical Practice Guidelines, and the 5 early symptoms of pancreatic cancer I just mentioned are also listed in these clinical practice guidelines as early symptoms of pancreatic cancer. Abdominal pain is seen in 32% of people with pancreatic cancer. Jaundice is seen in 18%. Worsening diabetes is seen in 6%. Back pain in 6%, and loss of appetite or weight loss in 4%. Fatigue is also reported by 4%. Abdominal pain is the most common at 32%, but even so, it doesn't exceed 50%. Pancreatic cancer is often already advanced by the time it's found, so I think it's really important to go to the hospital and consult a doctor as soon as you feel something is wrong. In fact, the guidelines clearly state that pancreatic cancer often has no early symptoms. Many videos talk about early symptoms, but please remember that there aren't always early symptoms. Now, let's talk about what you can improve to reduce your risk of developing pancreatic cancer. 8 risk factors for pancreatic cancer. The first is family history. If someone in your family has had pancreatic cancer, your risk of developing it increases. In fact, it's said that 5 to 10% of people diagnosed with pancreatic cancer have a family history of the disease. Having 2 blood relatives with pancreatic cancer increases your risk 6-fold. With 3, your risk may rise to 30 times higher. That kind of information can be the key to early detection, so be sure to share it with your doctor. The second of the 8 risk factors for pancreatic cancer is heredity. This is said to be the highest risk factor. Some people develop pancreatic cancer due to hereditary reasons. For those people, the risk of pancreatic cancer is said to be about 53 to 83 times higher. The third of the 8 risk factors for pancreatic cancer is something called IPMN. Many of you may not be familiar with this term, but simply put, think of it as a fluid-filled cyst that forms in the pancreas. There are various shapes and types, but these fluid-filled cysts accumulate in the ducts of the pancreas. This is IPMN. It is said that IPMN has a 20% to 30% chance of slowly progressing to cancer. Also, people who have IPMN are considered to have a higher risk of developing pancreatic cancer, even if the IPMN itself does not become cancerous. It is important to closely monitor with abdominal ultrasound or CT scans every 3 months, 6 months, or a year to make sure it does not turn into cancer. The fourth of the 8 risk factors for pancreatic cancer is smoking. The risks I will introduce from here are things you can reduce on your own, so please use this as a reference. It is well known that smoking increases the risk of lung cancer and stomach cancer, but it also increases the risk of pancreatic cancer. Men who smoke more than 40 cigarettes a day are said to have a 3.3 times higher risk of pancreatic cancer, so please consider reducing the number of cigarettes you smoke or quitting altogether. The fifth of the 8 risk factors for pancreatic cancer is drinking alcohol. People who consume large amounts of alcohol in a day are said to have a 1.2 times higher risk of pancreatic cancer. As for what counts as a large amount, when it comes to canned beer, canned chew high, or canned high eyeballs, the limit is about 2 350 milliliter cans. If you go even a little over 2 cans, it's considered an amount that increases your risk. For sake, the limit is up to 1 go. Since shochu has a higher alcohol content, even 1 go is considered a lot. The guideline is about 37.5 grams of pure alcohol, so please look up the amount of alcohol in grams for what you drink and check if you are drinking too much. The 6th risk factor for pancreatic cancer is obesity. If your BMI exceeds 35, it is said that your risk of pancreatic cancer is 2.61 times higher. BMI is calculated by dividing your weight by your height squared, and you should note that height is measured in meters. For example, if you weigh 50 kilograms and are 150 centimeters tall, you would calculate 50 divided by 1.5 divided by 1.5. Please remember that if your BMI exceeds 35, you are at risk. It's especially important to note that people who were obese during childhood are said to have a significantly higher risk of pancreatic cancer. It's well known that sumo wrestlers like Izutsu Oyakata and Kokonoe Oyakata passed away from pancreatic cancer, and sumo wrestlers gain weight from a young age to become stronger. It is said that their risk of pancreatic cancer is high. Here is the 7th risk factor for pancreatic cancer. It's diabetes. In fact, the leading cause of death among people with diabetes is malignant tumors, or cancer. And there is data showing that 1 in 4 people with pancreatic cancer also had diabetes. In other words, people with diabetes are about twice as likely to develop pancreatic cancer. Since there is such data, preventing diabetes may also reduce the risk of pancreatic cancer. The risk of pancreatic cancer. The 8th point is chronic pancreatitis. I explained that abdominal pain and back pain occur with pancreatic cancer. The digestive enzymes released from the pancreas end up digesting the pancreas itself, causing pancreatitis and inflammation in the pancreas. Chronic pancreatitis is when inflammation occurs in the pancreas over a long period. People with chronic pancreatitis actually have a very high risk of developing pancreatic cancer. The risk is reportedly up to 13 times higher. Since alcohol is a known risk factor for chronic pancreatitis, drinking less can help prevent it. It can also help prevent pancreatic cancer. If your alcohol intake has increased, please be cautious. Other than that, while there isn't solid data, there are some interesting findings, such as people infected with Helicobacter pylori having a higher risk of pancreatic cancer, and people with blood type O having a lower risk. There is also data suggesting that people who drink a lot of coffee have a lower incidence of pancreatic cancer. However, since there isn't much data on these points, they aren't definitive, but please keep them in mind as reference. So finally, if you become concerned about pancreatic cancer, what kind of doctor should you see? What kinds of tests are available? And are there any new testing methods? Also, there is a certain juice that is said to be effective for early detection, so I will explain about that as well. Did you know that there is actually no screening program for pancreatic cancer? In fact, even in the United States, the Preventive Services Task Force says that the disadvantages of conducting widespread pancreatic cancer screening outweigh the benefits. Therefore, it is recommended to conduct tests for people who have the early symptoms explained in this video or who are at risk. So what kind of tests are actually done? There are 2 important tests, ultrasound and CT scans. Wait, aren't there tumor markers in blood tests? Aren't those useful? For those who thought that, of course, tumor markers in blood tests can be helpful, but they're not suitable for early detection. There's a tumor marker called CA19-9 that's often used for pancreatic cancer, but actually it's said that only 55.6% of people with stage 1 early pancreatic cancer test positive for it, so it doesn't always increase. Since this tumor marker doesn't rise in about half of early stage cases, don't be reassured by normal results. Keep that in mind. The first effective test I recommend is an ultrasound. It doesn't involve any radiation exposure, and it's a painless procedure. This ultrasound checks your pancreas through your abdomen, but the stomach is in front and can block the view, so the whole pancreas may not be visible. Therefore, a normal result doesn't mean you can rule out pancreatic cancer. Recently, attention has focused on this stomach-related method. If you do the ultrasound test after drinking milk tea, like afternoon tea milk tea, the ultrasound beam can pass through more easily and the pancreas can be seen more clearly. So if you want to get a more detailed look with ultrasound, you can put a drink in your stomach, especially afternoon tea milk tea, and have the test done that way. It's also recommended to visit a hospital that can perform endoscopy, so if you're worried about pancreatic cancer, I recommend first going to a hospital where you can get an abdominal ultrasound examination. It's hard to quickly get a gastroenterology specialist appointment at a university hospital, and making a reservation is also difficult. University hospitals focus on advanced treatments like cutting-edge chemotherapy and specialized tests, not just diagnoses. It's best to first visit your regular doctor or a local clinic with a gastroenterology department where they can assess your symptoms and do an ultrasound. I think it's best to visit a clinic and consult with them, and if pancreatic cancer is suspected, you can be referred to a more specialized hospital. If it's difficult to determine with an ultrasound, I recommend the second test I mentioned earlier, which is a CT scan. There's one thing to be careful about here. A CT scan is a test where you lie down and pass through a large ring, but for pancreatic cancer, a CT scan using a contrast agent is recommended. A contrast agent is injected into your blood vessels, and then you go through the CT scanner in that state. This allows us to see inside your body in more detail. However, this contrast agent can be difficult to use and even dangerous for people with kidney problems or allergies, so please be sure to consult with your primary doctor before deciding whether to use it. But if pancreatic cancer is suspected, a CT scan with this contrast agent is needed for accurate diagnosis. So if you're having one and there's already radiation risk, it's best to use a contrast agent to see everything clearly at once. I recommend a CT scan. Of course, ultrasound and CT scans are not perfect, so even then, if the results are still unclear, if there is still suspicion, you should go to a more specialized hospital and undergo an MRI or have an endoscopy, where an ultrasound is performed from the tip of the endoscope to examine the area more closely. There is also a biopsy, where tissue from the pancreas is taken using the ultrasound and endoscope for a more detailed examination. These are the kinds of more precise tests that may be done. First, this may not be an early symptom of pancreatic cancer, but could indicate another cancer. I recommend visiting a hospital where they can review your symptoms and perform blood tests and ultrasounds. How was it? This time we talked about symptoms that are dangerous if overlooked. We discussed 5 early symptoms of pancreatic cancer, 8 risk factors, and explained in detail and in an easy to understand way what kind of hospital you should visit and what kinds of tests are available if you become concerned about pancreatic cancer. Thank you for watching this long video until the end. Let's review at the end. The 5 early symptoms of pancreatic cancer are abdominal or back pain and yellowing of the skin, jaundice, developing diabetes or worsening of diabetes, losing weight and feeling fatigued. I also emphasize that sometimes there are no early symptoms at all. And the risks for pancreatic cancer include having a family member with pancreatic cancer, having a family member with hereditary pancreatic cancer, having IPMN, smoking, drinking alcohol, and having a BMI over 35, having diabetes and suffering from chronic pancreatitis. I listed these factors. If you're worried about diabetes, I recommend seeing your doctor or visiting an internal medicine or gastroenterology clinic for an initial ultrasound exam. And next, what I would recommend is a CT scan using contrast agents. Blood tests can also be effective, but I also explained that you can't be reassured just because tumor markers are not elevated. It's a type of cancer that's difficult to detect early and often has a poor prognosis, but I hope that by referring to this video, more people will be able to lower their risk or detect it at an earlier stage. From now on, I will continue to explain information that can help you become healthier starting tomorrow in an easy to understand and simple way from a doctor's perspective. If you like, I would be happy if you could subscribe to the channel. And whether it's a thumbs up or a thumbs down, I would appreciate it if you could rate this video. Also, I hope you can share your questions or what you learned from this video in the comments section. Well then, see you in the next video.